Welcome everybody to Beautifully Broken. I am Patricia, Beautifully Broken today. Today I want to talk to you about the definition, shall we say, of what Ehlers-Danlos syndrome is. And I want to talk to you about some of the resources I can give to you and maybe fit in what led up to how I was diagnosed with EDS, Ehlers-Danlos syndrome. I want to let you know that I have some resources here, as I said, with me that I'm going to read to you, and I'm going to share those with you as I go through each one of those. I have a couple of websites open. I have a book, and I have a proclamation from the state of Minnesota about Ehlers-Danlos. But before I get started on that, I wanted to touch back to last week's episode where I was discussing Tarlov cyst disease. And the reason why I brought up Tarlov cyst disease last week, if you remember, if you listened on, I had been reading on a website or from an email, I'm sorry, I can't recall which one, but I had been reading where Tarlov cysts can be associated with a connective tissue disorder. And if you're watching online, I kind of looked back at the screen when I said connective tissue disorder, and now you're going to find out why. So I'm going to read to you the definition according to the state of Minnesota of what Ehlers-Danlos syndrome is. Ehlers-Danlos syndrome is a rare group of inherited connective tissue disorders that affect connective tissues in the body, primarily the skin, joints, and blood vessels. So I'm going to stop right there. So for me, in my body, when I found out that I had the Tarlov cyst, connective tissue disorder, and I was told to pursue Ehlers-Danlos syndrome, which is a connective tissue disorder. Okay, so I'm going to finish reading here. This genetic disorder affects the way the body creates collagen. So in essence, people with Ehlers-Danlos syndrome, I can only speak for that, your body creates faulty collagen. And that serves to provide strength and elasticity of the body structure. There's 13 different subtypes of Ehlers-Danlos syndrome with signs and symptoms ranging from mildly loose joints to life-threatening complications. Characterized symptoms of Ehlers-Danlos syndrome and hypermobility spectrum disorder may include instability and dislocation of the joints. You can also sublux a joint, which is a partial dislocation, joint pain, secondary arthritis, hypermobility, muscle weakness, velvety, soft, and stretchy skin, fragile skin that easily tears, bruises, and scars, abnormal wound healing, fatigue, lowered immune system, and less commonly surgical complications, premature rupture of membranes during pregnancy. And this one is really hits hard for me because it's very true, is debilitating musculoskeletal pain or vascular issues. Ehlers-Danlos syndrome affects 1 in 5,000 to 20,000 people worldwide. Okay, my hand is raised. I'm one of those. EDS and HSD is an incurable, which meaning it cannot be cured, and it lasts a lifetime. It slowly progresses with age, and proper diagnosis and symptom management is crucial. So our governor in Minnesota declared that the month of May would be Ehlers-Danlos syndrome month, hypermobility spectrum disorder month. I'm going to touch back on a couple of the things that I read to you in this proclamation. Again, it's connective tissue disorder. It affects the tissues in the body. So basically, your tendons and ligaments, they can become loose, weakened, and your muscles start to do the job of those ligaments and tendons, meaning when you have loose joints and the muscles have to take over for the tendons and ligaments that aren't doing their job properly, which causes the debilitating pain. Another portion that fits into this debilitating pain where it discussed the dislocation. And I want to say that I had mentioned subluxation. That's not listed in this proclamation, but a lot of people with Ehlers-Danlos syndrome, such as myself, will tend to subluxate, which means a partial, like I said, dislocation. So it could be dislocating your ankles or subluxing your ankles or knees or elbows, collarbones, wrists, ribs, SI joint, you name it, it can happen. And it is very painful. And I feel like in the society that we are living in, the medical professionals that I have personally seen and have seen people online through Facebook or Instagram have gone through some pretty traumatizing experiences with not being believed on how our pain is. And I'm going to say that for those of you that are watching on YouTube, as I've said to you maybe the first week, you can look at a person, you can look at me, and you can see that I may look normal, I might look fine to you, but that's not the case on the inside. So I'm sitting here for the 15 minutes of this podcast, and I'm in excruciating pain. And I'm not saying that for sympathy or to have you feel sorry for me or whatnot. It's just a fact. The fact of the matter is my body is in pain 24/7, all day, every day, and it gets worse as the day goes by. So before I go on to another reference about Ehlers-Danlos, I just want to take the time to say, when someone tells you that they hurt or they don't feel well or something isn't sitting right with them, please help them. Please listen to them. Please take the time to be courteous enough to believe in what they are saying and not push it aside. Because when you do that to someone, that not only causes the mental health factor to heighten inside of our body, our brain, our mind, our thought process, you're making us feel as though it doesn't exist. And when you can't see it, an invisible illness, that doesn't mean it's not true. So we'll go into that a little bit later, maybe in another podcast where we talk more about the pain and symptoms and whatnot and how it affects me. I can't speak for other people until we can get others to join in interviews. But I did want to say, just believe. That's all. Just believe. Even if you don't say it. Because, I mean, it's hard enough that we have to suffer through this. Don't make us be alone anymore with our thoughts. Another portion that I wanted to touch on is that Ehlers-Danlos, not always, because there are some people that are very young that have severe debilitating pain and other health issues that come along with this, children up to 20 or 30 years of old. But for me, and here it said it slowly progresses with age. And I can say for myself that I've had pain throughout my entire life, but this did progress. I was diagnosed at the age of 52, right before my birthday. And from that time on, it has progressed severely for me. And that's a very hard, life-changing event to go through. Just gonna leave that portion there. So it is important that if you feel you have any of these, symptoms, that you should be treated and seen by someone, go to the website, Ehler-Danlos Society. It's ehlersdanlos.com. Do some research. Find out if this is, falls into your situation, and get seen. Find someone. Reach out to people. If you don't know anybody that can help you, reach out in Facebook groups, or get in touch, leave a comment, and I will get back to you. I also wanted to let you know that after I was diagnosed with Ehlers-Danlos syndrome, there is a book that the doctor that diagnosed me recommended to me, and that is called Disjointed. And I have my book with me here, and I've got several different pages with sticky notes on there. And I didn't put those sticky notes inside of this book for today to, mark my place of what I wanted to talk about. I have these in here because when I first got the book, this was my go-to as well. I wanted to read what pertained to me and have something substantial to touch base with that could make it not only feel real, but give me the tools in my handbook, my toolbox to go to. Because this is a struggle. Let me tell you, it's a struggle. Kind of like the Danlos cyst disease. I've traveled down that winding road. But I do want to read to you something from the Disjointed book. And this book is put together by quite a few different specialists, and the doctor that diagnosed me wrote a portion in this book. So if you have Ehlers-Danlos syndrome, or if you think you may have the Ehlers-Danlos syndrome, this is a book I highly recommend. You can get it off of Amazon. It's maybe $20, $30, but worth every penny. And I want to read to you just a small portion of what it says about pain management, because I read that from the proclamation where it said, pain management is crucial, and it is. So in the book if you have this book, I'm on chapter 18, and it states patients with Ehlers-Danlos syndrome present one of the most chronically painful conditions in medicine. Pain in EDS, which is usually one of the first symptoms to occur, which is what happened for me, may be widespread or localized to one region, such as an arm or a leg. And for my case, it was in my SI joint. I discussed that last week and in the first podcast. The chronic pain is different from acute pain. So it's not just prolonged acute pain. The accepted definition of chronic pain is pain that continues longer than 6 months. Most patients with Ehlers-Danlos syndrome have experienced pain for far longer than six months, some for most of their life. Now, when I read to you those things, for me it really kind of gave me a purpose of saying, okay, this is true. This is here. This is in writing. This is real. This is not in my head. As I had said in the Danlos cyst podcast, I traveled down a road of seeing many different doctors and was disbelieved. And I know that there are more doctors on the the Ehlers-Danlos syndrome, or ehlersdanlos.com for the Ehlers-Danlos Society. There are more doctors in my state. I haven't taken a look at many of the other states, but there are more doctors than for the Danlos cyst disease that I have found. But that doesn't make the road any less easy for those of us who need the help, who need the care, who need someone to believe us, because even though these doctors may be listed on here, the majority of them don't take insurance. That's a hard pill to swallow when you have to pay out of pocket. And it's something I chose to do, but I'll get into that probably on the next episode, because I want to just give you the resources for today for where to go to and give you a definition of what it is. So on the ehlersdanlos.com, again, you can go to the physicians tab in your state, and it'll list all of the doctors out that either treat or specialize with Ehlers-Danlos syndrome. And again, I'm seeing quite a few more. There's also some physical therapists that are listed on here, and a chiropractor that I do see on here, who I might add has been one of the best resources for me in my diagnosis. But there's quite a few more doctors listed on here than when I had come to research for physicians to see. So don't be discouraged. I mean, I know that's going to be a feeling that you have, because I have it still too, in finding someone that can treat you or diagnose you. Just continue to advocate for yourself and be strong and educate yourself. Sometimes, I've seen a lot of memes online where, patients with a chronic illness or rare disorder, rare disease, tend to know more than the doctor that they see. And I'm not saying that lightly to be funny or to be a joke about it, but when you suffer in pain all day, every day, and you're researching, we feel like we know more, and we go in, and you need to be prepared. And that's just the bottom line of any disorder or disease that you're trying to get help with. You need to educate yourself. So, as I said, you can print off the proclamation. I believe you can get it on if you're in Minnesota. I don't know if every state has, their governor that proclaimed May as the month of Ehlers-Danlos month. But if you need a copy of that, I can get that to you. And also the book, Disjointed. There's a wealth of information in there. Go to the EhlersDanlos.com, the Ehlers-Danlos Society. I know there's a portion there where you can get in touch with someone and they will call you back. At least that was my case in January or prior to January, where I was contacted right away and given resources of where to go. So before we end this episode, I wanted to, like I said, just share to you what the definition of Ehlers-Danlos syndrome is. And I feel like when I'm ending this, that it didn't cover all of the bases of what a person feels. I read to you words from a page and from a book. But from my personal standpoint, I'm going to tell you that Ehlers-Danlos for me is pain. There's a lot of other illnesses that I've found out to have, and that I probably have had for a long time. And they have progressed over time. And for me, the pain is debilitating. I do spend a lot of time where I'm either lying in bed or sitting in a really nice reclining chair that my son bought me so that I can be comfortable. I don't go many places at all because of the pain. I'm in now a wheelchair 90% of the time. I use a walker and a cane. I fall a lot because my knees are unstable. I wear ankles braces. I have neck brace. I have finger splints. I have wrist wraps. I will be getting knee braces. I have braces to support my SI joint. There's so many things that what I read to you doesn't portray into the human aspect of what a person feels like. So though I know those words gave you the definition, there's a lot more to it than that. With that comes a long journey in life. And again, that brings you to the portion of feeling broken. Or at least for me, it leaves you to feeling broken, unheard. I can be beautiful, and I can be beautifully broken. So when we come back next week, let's delve a little bit deeper into my diagnosis of Ehlers-Danlos syndrome and talk a little bit more on how it affects a person inside, not just words on a paper or in a book. But I hope that this educated you a little bit more and gave you some direction on where to go. Again, the book is called Disjointed. You can find it on Amazon. The proclamation from the state of Minnesota, I can help you get that if you need it. Otherwise, you should be able to find it on the state's website, or you can check your local area to see if there is one, and also the ehlersdanlos.com website. Thanks for joining me, you guys, today. I really appreciate it. Again, we are all in this together, beautifully broken. Until next time.